Hi, I'm Dr. Sedano, the Director of Clinical Support and Education at EDI Diagnostics. Today, I want to talk to you about blood testing as it relates to weight management. As you most likely know, overweight and obesity is strongly associated with conditions such as type 2 diabetes, hypertension, and cardiovascular disease. Now, the EDI Diagnostic Complete Weight Management Panel, it can identify insulin resistance, prediabetes, metabolic syndrome, and cardiovascular disease risks. You may also know that recognizing these risks means earlier intervention to stop or to delay the progress of these conditions. Now, particular to this panel is the measurements of adipokines, such as leptin and adiponectin, which are secreted by adipose tissue. Now, recent studies have suggested that adipose tissue plays an important role in the development of the conditions that I just mentioned and their complications through the secretion of these and other bioactive molecules in the adipose tissue. So when assessing for conditions associated with increased body weight, the pre-built EDI Complete Weight Management Panel is the go-to blood test panel. Now, aside from the classic blood tests, which I'm sure you're familiar with, such as the lipid panel and thyroid panels and other critical biomarkers of health, the assessment of adiponectin and leptin can provide significant information. Now, adiponectin appears to have an important role in energy metabolism through the regulation of fatty acid oxidation, and diminished levels of this analyte have been associated with increased prevalence of obesity-linked cardiovascular diseases, including ischemic heart disease and peripheral vascular disease. Now, leptin is primarily produced by the white adipose tissue, and blood levels are correlated with body fat stores. Increased leptin stimulates the central nervous system to reduce appetite and to increase energy expenditure. Leptin is thought to play an important role in the body's response to food deprivation and starvation. Now, obesity is most commonly associated with increased levels of leptin, and is thought to be due to what's known as leptin resistance, similar to what we see in insulin resistance. I hope this information serves you and your patients well. Until next time, I wish you all the best personally and in practice.